Hi everyone. This is our second COVID-19 update this December. We're hoping to do another one on January 6th, once again at 11 a.m. So January 6th at 11 a.m. will be the next one, and it will be telecast and streamed on the web as this one is. Like always, we're going to begin with the Premier's statement. He will be speaking first in Iqaluit and then in English, and then we'll have an update by our Chief Public Health Officer, and then we'll be taking any questions from media here, as well as any media that will be messaging us remotely.
Tana January kingulam January 6 mili apa mo katay matse na to sa ratit sikan nila mayutay matse na to sa saulo na hasaw yakullo tana sibulak tiyo kali malawlo ni inutito kallo na titulo anna hang nang itulo yung marik to saktit sigalang ang mayo kamalo pi wala yung lagi apek susitakwe.
Okay, udakon kuyan na may uli malene tavanigum na may gavin. Udakut ya pakan Nunavut miuten na nalatun amatutun. Udango yok nalunerum nasigata 74 ngoyo Nunavut jualen Nunavut iluane. Tako nunalen atok tau simalapon. Ataus kamanituamen 6 akvianen ataus ilulemen 25 ngovun Iqaluit 9 panotume. Atause tikitadzuamen 22 kangitlinumen amma 9 sanarayamitun. Tamakua iluringen duta Patterson mon tununiapakam. Tamakua taututlunigen kubwasip fadlianingen nunalen nuvanadzualen pidjutigidlutigum duta Patterson nalunasi gumnalauman. Tamanna Nunavut matusimayaukan narunarnerninga January 17 mon kayusakudlunium. Taman ilinyarvin amma gavamakon matusimanerningen January 17 mutikidlego iqana yaqadlaktartu ikisian iqana yarnerpon takwa parnautingin naluner padlianerpavun tamakwa nuvannerjualen amisoqu padlianengi tautlutigo nunalin amison attuqtavadliadluten ippinnernassimalumma iqana yartikuluvun assoqudlattarlute pivirutilermatam. Tamakua anya sutin lutan amanunalin tusaumatitijivun assurudlattaarlut nuqqanginnarlut pilerimmata qawi sartu nuvannerjuartarangi kalwamanga nunalittinen amma qimeqquvadliallut nuvannerjua taapadlia ningi qimeqqujavadliallattaarsimammata tamakua iqqaitittigumavunga nunavummiutanum tamakua ilisaqattiarlutigu assururningin ippigillutigu isumaginniarpafun iqqanaayartikuluppun tamakua iqqanaayartivuila nuvannerjuar missaanu quviasuvvikulugaluartilligu iqqanaayariaqalaumata uvattinni ulugaanartumi qunnatigu illumiu qatingin ilakulungin qimasimagiaqalauningin taanna ilisaqilligu assualo quyannameerumavakka assururningin iqqanaayartivun taanna nunavumiutani ulugaanartumi qunnatiguilaam qaujimagatta taanna atorsimagattigu anigorniaqillerni qaujimamilluta nunavummiutaulluta sanginittinni tigumiaqattam so taanna pijjutigillugu iqqaitittigiaqumavunga tamanna nunali sanginingin pijunnautaqartuinniaguatta nuvannerjuar saimmaqunatigu nunalitta asinginnuttau iqqaitittigiaqannerumavungaila amma quyannameerumalluguillu taakkua nunavummiuta quviasuvvimmi nirinnau katigumna runnert giaqalausimagattigu ilisaqittiaqumavavun nuqqartittilaumayun audlaarnialauttu nunalin asinginnum amma qalluna nunalinginnum quyannameerumavivavun nalunarunnerman nuvannerjuar ajigigajangimmagu atuqtavu amisuugalua ullume amisuukannerajamata sivunittinnin taanna nuqqarningikkuttigu qaujimagattatllu taakkua nunalinnum audlaaqattarni nuvannerjuarmen nunalinnum asinginnu saimarniarningin ippinnernassimammata tavvuuna qujalivunga audlaalaungittunum Tana iqaititikan rumavungaila Nunavut takua Dr. Patterson, Luta Patterson, atulakuji simayangin, malinarlutikon. Sivudlupame, angikaksimata, takua leo, idumio takatigingit tavon, pulaga katautingit yadlakain nasimaluta, kapurtaun nato, kapurtaulen, takua leo, ilagiarutingi, kapurtau simayan, piyon narute, kapurtau gajapon, Kinamen matuasemen napadliangin nakta amatako kawisaktaw yukareharone nuva gasugo yukarone la kawisaktaw kattarlen tako ukala gute nalune tiataw simayan kawimagatta tana Luta Patterson pekoyivuyangin ila atulakoji simayangin atuin nagahagattigon kawimagatta manayo 8 ngulupto nunalen atoktaw simalumatan Nalo nait yasemat lotegon piviro te vadlianite kana yattita angumatigasunenge ulwanattume kunatigo nunale limavo pijjutigidlewen nalo nairomavunga nunavumiutano tana assuarigattigo iqana yaqatigidlewen iqana yattivon parnai vadliagumasemagatta gavamatoqakkonne tussiraagunneattumen qauyumavugu maannaoyo lutaan aanniasuttiinilaan ammataakoa ikajortigi katattavu amigarnittinen tamakkuadlo ikajortau kanneriaqarningen kaportau vadliaqattassimanningen nunalitta ilwanittum ammataakkua qimiqquvadliaqatammata nuvannerjualeen kikkunne kateqateqarsimammagaata taakkua silatingagun ikajortau kannerunnarnermen qauyumavugun ammataakkua uluruanartumi jeikkuteen uttuutigilugen ukua kiinarmu matuan amma annoruan taakkunninga tusseraarnermen nalunersimavugun amma taana piluanguartume qauyumattiartugu nunavumme attortausimaninga idlukissarnittia uluruanartumi tittigutigisimammagu piluanguartume maannauju tamanna ilisari luanguarumavara idlukissarnitta pijjuteqadlarisimamma nuvannerjua angiqqamiqujisimadlutaila ilisarigumagaku tamanna pannertu attortausimarjuarninga piluanguartumi maqqunne uluruanartumi kuteqarsimammata sivudle tamanna nuvannerjua amma qulaagukkanner puvadlunnermu attortausimaninga idlukissarnerpun ippinnernallattaarsimalumman nalunaikannerumavunga nunavumme tussaqarpadliagatta taakkua nammenne qawisarunnertu nuvannerjuaqarunna nikkaluarmangata tamakkua qadluna nunangane tikiseisimannitta missaanu nalunairunnarsivunga tamakkua Luta Patterson nalunaitsiarsimammagen nuqqartittijaangittiugalua kisianne qawisarunnernitta nammenne taana pijjutigu nunalettinne saimmakkannerunatigu nunale asinginnu piniarmatam tamakkua qanuiliullattaarpadlianiarnitta nalunaitsiarniarpavun udluin aggerniartunnun tamanna qauyimagatta assorumnartukkuuqatta nunalelimaavun attortausimaju nunavulimaamu taana attortausimalumman taana iqqaitittigiarumavunga nunavummiutanne nikagusuqattautita taana uqumaittukkuuqaluarluta ajungunnitta pijunnarsimagatta taana ippigittiaassutigu iqqaitittigiakkannerumavunga amma innakuluppun pulaariarunnangikkaluarlutigu iqqaitittikkannerumagivunga ikajoqqannerunnainnaujaqattigu tamakkua innakuluppu piluanguartumen sivudluppaame uqaalaqattarlavun taakkua innakuluppu qanuingikkaluamangata titiqarvigillutigullu titiqarvigigunnaruttigun uvalunne inussiutene pajuvvigiqattarlavun attakuqattautingikkaluarluta tamakkua angijumen pimmariujunne pijunnammatam kingudluppaame nidluppadlialunga quyannameerumattiappunga aqqaagumu tikippadlialummigatta nutaamun tamanna iqqaikkanneruteme taakkua Luta Patterson nalunaittiarsimayangi malinnarlavun katequyaunginnitta quviasuqatiginniaraluarluta aqqaagumun tuqaarpadlianiarluta tamanna iqqaikkanneruteme nalunaikkannerumavunga so quyanname udlakun nunavummiut naalattun nunavummiut that are listening. As of this morning, Nunavut has 74 positive cases of COVID-19. We have active cases in 8 communities, 6 in Akvian, 1 in Baker Lake, 1 in Iqaluit, 25 in Iqaluit, 9 in Patterson, 1 in Iqaluit, 22 in Rankin Inlet, and 9 in Sanagayam. I will leave the details regarding these cases to Dr. Patterson, our Chief Public Health Officer. In response to the rising numbers of cases, Dr. Patterson has recommended that we extend the lockdown until January 17. This means schools will remain closed and only critically essential Government of Nunavut employees will be working in offices. The mounting numbers of cases spread across multiple communities means that our frontline workers are stretched to the max. Our nurses, doctors, and communities, as well as healthcare providers, are working around the clock to administer COVID tests and conduct contact tracing. Please make sure to be patient. They are doing their best to respond in a timely manner. I know that staff working on COVID response have once again missed a holiday with their families to do their part to protect our communities. I want to thank them once again for their hard work and the sacrifices that they've made. I know that Nunavut are resilient and kind. We all need to be community-minded to contain the spread of the pandemic in our territory. I want to thank everyone who has done their part to help us stay safe. Thank you to those who have canceled their Christmas dinners and their holiday gatherings. Thank you to those who have canceled their travel plans and decided to stay at home. Travel contributes to the spread of COVID-19, so please, if you don't need to travel, don't. Even if you are triple vaccinated. Do not travel within Nunavut and do not travel south. Staying home is the best way to stop the spread of this virus. I hope that every one of you does your part to keep Nunavut safe of Omicron. That includes staying at home and avoiding gatherings with anyone who doesn't live with you, getting vaccinated and encouraging your loved ones to do the same, and getting your booster shot when possible, wearing a mask and getting tested and isolating if you have any COVID symptoms. We all need to keep adhering to Dr. Patterson's advice. With active cases in 8 communities, we are approaching a breaking point in terms of our healthcare capacity. I have been working with staff to draft requests for assistance from the federal government. We know Nunavut will need more nurses and healthcare professionals, support staff to bolster our teams on the ground, contact tracers who could help remotely, personal protective gear such as N95 masks. Above all, our territory urgently needs more housing to allow every family in Nunavut to safely isolate at home. This is particularly important considering what's happening in Patterson, where we have a tuberculosis outbreak followed by a COVID-19 outbreak. Nunavut is also working on procuring rapid test kits. We hope that the tests will provide another tool for managing the outbreak in our communities. We will be providing more detail in the coming days on the test kits. These obviously are very difficult times for all of us, and please take care of one another. While we don't and can't visit our elders, we can continue to provide them support in other ways. I just want to remind Nunavut to please call your elders that you love, and whether you write to them or drop off country food if and when possible without being with them. Finally, I want to wish everyone a Happy New Year, and that remember, we need to celebrate safely without gathering once again. Be kind and stay safe. Huyaname.
Good morning. We are seeing COVID-19 cases continue to rise in the territory, and we know that some cases are a direct result of visiting in homes. I cannot stress enough the importance of following public health measures. I know this is difficult, but right now social gatherings are not allowed. Whether you are vaccinated or not, no one should be attending home or public gatherings. At this time, we don't know if the variant in Nunavut is Omicron, but if it is, we know that it spreads faster than other variants of COVID-19. Since December 21st, we have gone from no cases of COVID-19 in the territory to 74 cases in 8 different communities. This is a concerning rise, and it is putting extreme pressure on our health system, including our ability to manage contact tracing and surveillance testing.
Taku balia gata no vajoanak 19 linnik tamako ami songo balia tu inaktunik Nunavummi. How you maluta tamako ay chuluk tau simayuta ko pulaga hatam ning inut angekariyo yuno pidjute haktuting. Taima pimmariuning aneo harasuale gelakan nerumayong tako malitaw ge hamning anna hamnang itulirinang malitaw huyaw simayun. How you magalwak tung ayong naktilugu taman na kubea subiu tilugu. Kasi anik tamak ko mak ino katigi katigatara hangilaki kay nang ataman na oyok. Kapayaw si magalwa ko kapayaw si mangikalwa ko wiluni tako hangik karingita sino tubalu amisu nito no pakatara hangit serto si. Man na oyok how yung mangin at tatana no badyanak no nabumor si mayok Omicron ng mga tay na siya masakay tulari alumat asingin ni no badyanak 19 si mayoni. December 21 minik tema pitahangit sa law to Novadjanak 19 mut Nunavummi ulumimot 74 ngulirik to 8 nik Nunavummi nunalin na jigingit to ni taman na sumalon na rin sumalon na lakit kami songo palyaning itam malutamakwa megarsil nitinan na hang nang itulirik jutinik at surom na galakan na rutaw balyalak to ang maluawlat sigur na nitinik katiyaw si mayunik kawi sa palyanang mo tamalo Adding
to the concern is the numbers of holiday travelers who will be returning from the south over the next weeks. Due to the high transmission rate of Omicron, there is an increased risk that we will see additional cases of COVID-19 introduced due to travelers returning from the south. This is why it is vital that people traveling home who are not triple vaccinated isolate for 14 days upon arrival. This is the best way to protect communities from outbreaks. It is also important that anyone who develops symptoms, even mild symptoms, isolates immediately and call the hotline at 1-888-975-8601. If you are sick, please stay home. Please don't take the risk that this is not COVID-19. This is for everyone's health. And we do realize that wait times can be long, but we ask everyone's patience when calling the hotline.
Sumalon na kalakan ni Ruta Mayo Tamako Hatsi Ning Amisu Tila to Hikarex Mayo Kalunani to Pinasaro Siulatomi. Tako Amisu Sama Palasamanning in Nut Omicron Mikalunani. Kaya mahulugan ang laki na sa na ito tamako asik kaning ininubadyo anak to halam ng anik tayo ko otos si malik katakalunan ng atuin. Kaya may mapimariyo yutay ko ito tikila ito ang kapaliyayot. Pingaswap ti kapayaw si mangikutik anit tiliga kalatot ulunik 14 nik tikit si malikutik. Taman na akaw na pangula ito sa pumayaw si mahulugin unali sa mapaliyabiw kan ni hunagin. Pimariyo bulukin atuin na kanoy ko tikalito ako ni. Pilo ato yang ikalo ako ni. Anit tailit sa utigigalik. Ukalalo ni yung asit tumakikangit tumot 1-888-975-8601 mo. Hani magubit ang ikasi matuin na rin. Ulugan at tumigutaw gud na kano wadyo anak 19 utuin na kaham ni nga ni kaya may sumagyahap tugod. Tako kikuli mga kanoy tailit hulugi tayo may liyo hugon. Utakit sa tuin na ritsita na ukala viyo utakikatang ataman ni kakalimami ukala gaswak tu galawat utakit sa tuin na katarit sikiw yaw katang na to si
In an effort to assist in identifying cases early, we will begin handing out take-home COVID-19 self-tests to travelers returning to Nunavut, and we will announce the start date as soon as this is confirmed. Individuals will be asked to test themselves on days 6 or 7, and then again on day 12 to 14 after arriving home. If you become ill, test right away. Anyone who receives a positive test result should call the hotline immediately. I must emphasize that these tests are not a replacement for isolation. A negative test result does not mean that it is safe to leave isolation early. There is still a chance that the virus is has not grown enough to be detected, and yet you could be spreading the infection to other people. Self-tests will help identify and contain the virus faster if they are used as an additional layer of protection. Rapid tests are not a substitute for other methods of infection control.
At so tilutan aluna yega so tilutan no wajoanak tapan le ayo ne khilami yukut. Tema tunyo kaya hatalalak tiguangit kami no wajoanak 90 mini khawi sakoti yo ne tamakunong at tikipan le ayo no Nunavut. Dan na khawi kailak tigo khangapig yataw la mga khawi malito akot tigo. Kikutu inay tay ko mini khawi sakoyaw hatalak tu ulungani 6 ngani 7 ngani luni. Ambalo khawi sakkan nilang melutik ulungani 12 ngani umbalo 14 ngani ang yakagin ni umbalo ni kanimat tuarovit khawi satsaw tigiya khalagayak tutitay ko atong lugi ang yakami khawi sakuti oyo tema nalo na daw guvi tema khawi sakuti ko ukhala tsaw tigiya khagayak tutitat sumunga wasitumo khala biugun naktumot Pimareo nga ninalo na sikan na hakongata ko khawi sauti king of beauty ng mata ni taili khuyaw si manangmun. Tay ma nubadyan naktohangin na kuti ugalo khata ko nga khawi maguti no tay ma ani taili ga khagajak tuti suli. Tay ma ta na nubadyan ibitimi nga nito na hanga sangi lo akto ni tay ma kisi ani sang magun na lo akto ni asin no ila ne ko khilami yo ko khawi na sakta gum na sungum mat sibong agum. Tako namin khawi sa roti yo kayo roti na ato nalo na yo tawluti kamalo sa matay ligo tawluti no badyo na mi khilami na sakto ato taw siya kanito akata ko hakan nga go sa pumiyaw go tiulutik khilami yo ko tako khawi sa roti yo king beauty jang ito asingin no siya mapala taylit sinama malita ko yaw sa mayon.
It is important that everyone understands that every layer of protection is important. Isolating when asked and when you feel ill, wearing masks, maintaining physical distance, getting vaccinated and boosted, testing and staying home, all combine to protect ourselves and our communities from COVID-19. Every time we miss one of these layers, we increase the chance of spreading this virus across the territory. Please follow all the measures. As we've mentioned, the rise in cases is putting a strain on the health system, which is already stretched thin over the holidays. We have seen other provinces and territories reduce healthcare services because of COVID-19. We need to stop this virus from spreading to avoid limiting Nunavummians' access to healthcare. Please follow the public health measures. If you have been asked to isolate, please do so. The risks are too high right now, and we can only contain these outbreaks with the help and cooperation of all Nunavummians.
Pimareo kikuli tukisiumat sera hamningi ta ko kisuli sa pumbiyaw gutiyo yo pimareo yo inaw mata malita ko yaw simayo. Anitay li ko yaw guvit ubalo ni kanima yo yarawit. Matuasimay na katamnek inuhatin ni kanil yakalwat tayo katarlosi kapiyaw katarlosi ang malupingayon ni kapiyaw lusi kawisak tayo katarlosi ang akasimatoy na katarlosi tako ilo natay katitugi tako sa pumiyaw gutiyo na mata na minitin ni kamaluno na katitinik no wadyo anak 19 mi Tako malittaw ilito ay matanalya to inatay masang matitsibalya lang nahatakata no na bumi. Tako malittaw siyang nahatakang lekto tayo mangalima. Ukakaw gamata ko amin sa kong palya si maningin no ami gaksili palya to inahatakata nga hang mangituloy juti unik. Tako ami gaksigilaw to hikak na utilugo. Asingin nilo kanata mi abito si mabiyo ni Kawis malerto go tamakwa pejek rautin nakateri valle samalerto atu nahangi valle atu nalerto luan na hamnang itulere nang moinulit daw go tinik no wadjo anak 19 pejo tigillogo taman nano khapti gale go no wadjo anak sa makpalle ngani kamalu tamakwa no na bumi atu amiga silo kan ne rumni khunagit anna hamnang itulere nang moi pigiyaw go tinik Tay mamalit siya ritsi, ana hamnang itulere na mamalit tayo huyaw si mayonik. Anit tayo li huyaw si magubit, anit tayo li khatarit. Tama ko, ulura na tumilo ang atamaan na kisulima, tayo ko siya mapala tayo li titsigur na katay, kayo khatigilo ta. Pilire khatigit siya tayo na ulutilo no na bumiulima.
Questions?
Let's keep this on. Hello? Okay. Trevor Wright, Nunavut News. Has there been any hospitalizations from any of these cases yet? I heard anecdotally from that there was one in Rankin.
Trevor Wright, Nunavut, pibalya yung lirikuni, anna valum ne unito hasima batako nangat. Nuwadyo anak tasima yun ito saksima magaw kang sinang unit simayo kang ningani.
Yeah, there have been, I think the number is at 3 so far, people who've been hospitalized due to these outbreaks.
Pingasulak naman na unit si mayan na lumitaman na sa mapalya ni pigalaw tiluguni.
Are you exploring any solutions to help raise our current healthcare capacity given messaging as of late?
Kana aksyo madjutigun na to ni tamakwan na nang ituliri na mapijik sa kauti pibalak tagun na hulugi kano isa manak taman na ikayok tagun na kayang mga atsi.
Ya, kuyan namin tanap kutitiava tam kimikuin na datarata uluan na tumekon na tigununa bumiute itiatana amiga kutigi si majavo piluang waktu mesai mapadya si maninga nuna lenun amisunut itni zaman taman na kimiko badya si majavo manna yo tilok tu si yakka kana yativun tamakwa kanuturun nang nernitin tusraga yaknerut government tokkun nalunner si mayunga taana neriuginya tabu kayu si badya nerninga apokote kakogumina kayangimma nuna bumiute uluan na tumekon na tiguilang. Right now, we are working very closely with our officials to start preparing an ask to the federal government in terms of capacity issues that we do see, as outlined as a concern that was brought forward by Minister Main at the last press conference in terms of the ability of the healthcare system. So we'll be working with our teams to ensure, as noted earlier, explore areas where if we need more nurses or healthcare professionals, in particular to support and bolster our teams on the ground, as obviously the outbreak has reached 8 communities thus far. So we're monitoring that very closely with the Department of Health in particular.
Steve with CBC. Has anybody been able to confirm if any of these new cases from this month are of the Omicron variant? And on that note, why is it taking so long to confirm this? I think it's taking approximately a week or so, you said?
What's your name? Steve, CBC Kudni. Tako na luna tao si mavana leto inuwadyo anak tao si mayo Omicron ng mga ata. Pinasa ako si ulo alak to sumako ni utak katamakwa kao iyaw gaswag ningi.
Thanks. Our timeline for identifying variants has always been about a week to 10 days, and it's simply it's related to the time it takes to ship samples to labs that can do this work. they're also having their own staff shortages and increased backlog with everything that's happening in the south.
Kaya namita ko tayo mga kunitigi katakayot si mayo kano ito mga tanaleng ang mga tanubadjuan na kawiyaw sa kaswang ulo ni 7 ni 10 not tako alo lak titaw kataka haksuti taw nung kawiyaw sa binunang ng 7 not ang malutay ko amiga simimate kanayak tingin ni ang maluta ko utik titaw balyan ng ite mga kunitigi lakak taktoy.
So yeah, no Omicron variant detected yet, I presume. And how long is it taking for people to get tested right now? Like, what's the turnaround time for people who do get tested for COVID-19 in Nunavut?
Suli Omicron takang ito kay amalohan utigilita ko kawi sakto yo tamani Nunavut me kawi sakto law tilugay kiyo jaw gaswa katakhat.
It depends on the community because for most communities, there's still the need to fly. There is the need to fly samples to our labs in Rankin Inlet and Iqaluit. Once the samples get to the labs, they're tested within 24 to 48 hours.
Tako ano naliadjigi hatang ito tako ilo nating ilata mga hangatayo kutikiti tawlo tikisane hatang atakang sinang mo kalon nulo. Kawi sabingin no tako tikisimalak tilugi ka kay 24 ni 48 no kawi sakto gun naksakat takto.
I have a question that was texted by Corey Larocque from Nunavut News. The Premier said Nunavut is approaching a breaking point. What does it look like if it goes past the breaking point? Will Nunavut be left untreated? Is there a chance you will have to choose which patients are treated in hospital or not? What is it specifically that is stretching healthcare workers to the breaking point? Is it hospitalizations, vaccinations, testing?
Tana titikatigo khrisaw yakapir yokori larak nunat ser news kunni sibulak tiu khakha mataman amigar silla rilerat tema litama amigar sinibo ngatano amigar silo alerut tamakko enuli sakta gunna ilit sa marilakat solo tamakko anar bilare do balokapiyaw gali pitsutigillobi.
The biggest strain right now is with contact tracing. Our ability to identify and follow all threads of transmission is being hampered by the sheer volume.
Tana surunan nagpangoyo at suru tigiyabo katiyaw si mayuni kaya sa paliaga so ang nibut nalo na si paliaga so ang nibut amakwa sa magbiw si matuin na realin ni takwa amigas sila ang matingit nakpakayabo takwa ami swalo ni kung inot manaw yo.
Hospitalization hasn't been strained in the same way, but as if we're not able to adequately contact trace, there's a risk of uncontrolled spread that will raise the risk of COVID spreading amongst people who are at higher risk of severe complications, and also people who are in critical industries that may aggravate the impact to the territory as a whole.
Tamakwa na velo no unihatam ning no taman na amigasing balyang itu galo tay matsay na kisa ni tamakko naman ang ito katakati yaw si mayuni kawi sat serum nam nebu taman na kawi kay gum nam nebu luk kati yaw si mayuni nuwa jo nak tulin no awlagat saung ito may sama palyali kayang at pilo at tamakko luga nak tumigot ham narsano kanim magot ham nam narsano Amalo tamakwa pimario yo aula tauga le dikana ya bero yo tamakwa solo matugia hatu na kayakto tamakwa kisulemano na bum akawngili ko tiula kayakto taman na sa maktulla kalo na kan.
Trevor Wright, Nunavut News. Outside of Iqaluit, has there been any other communities where community transmission has been identified?
Trevor Wright, Nunavut News Connect. Iqaluit sila tani nunalid na siya maksimani o yumikaw yung nakto kaksima ba?
We're still trying to figure that out. In a few communities, there's been more than one introduction, it appears, and so staff is still identifying all the different routes or ways that COVID was introduced and how it has spread.
Sulla hauiga saatavu tämän nalunang ito ataw seung ito tikit to hasima yununalinnut tema sama pallialik tuminiutsutik kana yakti hauiga saatu kanu tamakku nunavumutikin ng mga ata balon kanu nunavumut nuvajuanak tar ng mga ata sulit taman na hauiga saatu nunalinni.
If there's still a risk of transmission for fully vaccinated people, shouldn't they isolate, I suppose?
Taman na ulo kaya ng kapiyaw si mayugalo atangyak tumisang magsigun ng ningin ni sumalyan itelit itaw ngilat tao tekwa.
It's probably lower than it is for others, and it's they're also at greatly reduced risk of severe infection from COVID-19.
Tema sama sigun nam ning apa sen sama ulo kaya nak tumingin nagsaugun ng ata malutamako kanin madjut khalaki gun nak nagsau ningi tema pingin nagsau mata tema sumalong nang inagsay atangyak tumikapiyaw si mayoy.
Steve Silva with CBC again. I was wondering, do you have any regrets in regards to how the Nunavut government handled free rapid tests? I know that that's in the pipeline now, but I wonder, like, over Christmas it became normalized. A lot of people took the test before they went to family gatherings, that kind of thing. I wonder if that had been made available here, do you think some of these cases that are popping up now could have been prevented?
Steve CBC kunni ugwaki tamakko no nawagawa makkungi kano aulat sila mga ta kuang kami kau isakat takut nau tau yo atuin nau ngit sauti atuin nau sauti gilaungin mata sulo khuga su bimili kalluna ni tamakko katilaungin nammini mini kau isakat tang ata tamane le atuin nau semalaungin mat kaman no gwa ko tigibiu.
I think it's too soon to get into that sort of review or defense. I think the important thing is we move forward from where we are right now.
Manna lekila mi ulo atutan na kiyo yaw gaswalo ni kanul laki taman na pidyo tekam ng mga tema sulu ho sa rigun na luang itaka pimariw na sabog li tayo maman na sibu mugi ako tekalar na buman na mi sibu nit satin.
And in regard to Nunavut government employees returning to work next week, what is that going to look like? Will it be like a normal affair, or are there any changes in the works? Is it being delayed, et cetera, et cetera?
Well,
the orders, public health orders from my office still say non-essential workplaces should be closed, and my understanding is departments, including Department of HR, are working out the details of that as we speak.
To January 17th? Tako nila aneham nang itulang ng mumalitaw gali nalo na si mama tapi makayong ito ni kanayali matu si manayaktot January 17 munuta ko alo kanayakto lirik ko akit so yataman na kanoilingan ng mga.
Ya tan kimikutyagati kumanne yo naluna te watala te gutana kingu baga te ga khasiman ninga Nunavut matu si magya ninga ja January 17 mu tan kimiku wadya ka te te butako kana ya khati gidligo civil te Minister Lightstone bilwang watume kanoilingan ng mga tan tusaka syame agirtune audune naluna sigum nasiguta naluna natukun kisiane takwa luta Patterson malako yang malin nangyatigum iqana yaga khatlatu kisiane takwa iqana yaga khagna mata kisiane naluna gum natugudum yo ko elin yave kulwen amma iqana yatin matusimalan yanning aman mo January 17 ngu gasumninganun kisiane sibumon qimiqu kanun yagatta khanu lingalum mangata khanu tigi nunale attuttaw simalum mangata qimiqu gahum yagatta taana piviqartigi tiarniaqattigu qanuilornaamangaatta sivunittinnum kisiani nalunetiarunnarpugun taana pileriarivatliakautigisimagattigu maannauyo pinnasuarusiulaattu pigiareaqalorsimagaluammata tamakkua iqqanajariali uterniartun kisiani kinguvasigiaqattigu tamanna January 17 muukainnartu naluneerunnarpavun maannauyo. As Dr. Patterson indicated with his recommendation of the lockdown being advanced to January 17, the GN will be closed except for essential services. Right now, I am working with Minister Lightstone as well as the deputy ministers in terms of the rollout. As information becomes available, we'll ensure that we share every information on that particular front. But we do know that there are impacts to the schools right now in terms of with the order of advancing that to the 17th. But we'll diligently work with the departments to ensure that we communicate that to the employers as we move forward from this point on.
Trevor Wright, Nunavut News. This is probably for Dr. Patterson. With this most recent set of outbreaks, what does the vaccine uptake look like right now? Like, are more people getting vaccinated with these most recent outbreaks?
Trevor Wright, Nunavut News, kunni tamanna kapiyaw hattakto amisung mapalassimaba tamanna sama palyani pigalawani.
Yeah, I don't have the exact numbers with me right now, but we do know, we know that a number of communities have reported increased demand. At least 2 used up everything that they had, and others have extended their hours for to meet the increased demand.
Khatshila yung mga tamisong mapalasamaning yung mga ikarakto nga kisani to saksimayo nunalini amisunag sa kapiyaw hattakuman gialalertot ang malumakko ni nunalini nungutis ni makainaktot ilangin nilo ikakangin ni ang mabarak sa hattakto tamakko amisunag sa kapiyaw hattakumalakningin.
And that's one of the benefits of slowing the spread of this, is that it allows time for more people to get vaccinated and for the benefits of the vaccine to kick in before they're exposed to COVID-19 infection.
Taman akaw valero tige nga taman na pivihatit sinir tamakko kapiyaw hattakum nakhulugi taman na lokaputi ato te harun nakhulugi tay mga kapiyaw sa malaktilugi sa pumiyaw hataw sa magun nakhulugi.
Is the increased demand affecting like services? Like, are they able to meet that demand? Or?
Ang matigong nakata ko amisunod sa kapiyaw gumalak sa malaktilugi.
In most cases, yes. Staff in many communities are putting in incredible hours to meet that increased demand.
Ilaw nagalangin nita ko ang matigong naksamatsak to tamako yak kanayak tino na linni kakasalon ni kanayak hatak to tamako amisunod sa kapiyaw gumas sa malaktilugi ang mati gumaluti.
From your perspective as CPHO, what do you think is, I guess, driving healthcare workers away from this system, I guess, in the time of COVID?
Imbes magyangin niya anaham nang ituloy yung mariuluti sumata ko anaham nang ituloy ng may kanayak ti nuwadyo anak to kalaktilugo no kapalya katak sumaba.
Do you mean from Nunavut or healthcare system as a whole?
Nunavut and healthcare systems in general. Is it more stressful? Like, what's driving people away from, I guess, working in healthcare?
Well, it's been, for many healthcare providers, it's been 2 years of incredible stress. That's contributed to shifting jobs in a number of ways. There's also increased demand, increased need for healthcare providers in the south, and where Nunavut is dependent upon people coming in and out on short-term contracts to provide many services, that's less of an option than it would be under normal circumstances, and that's contributed to our shortages of staffing.
Amisoni pinjuti hartu tamakuan na hamnang itulirin ng mapiliri si malangatat suruti hartu timakgo niya kago ni tamatumingan na wadyo naktulirin ng mo ilang ita kasi mayol laki ulit sutik ilang ilo kanayangin niya singin niya sa jihatar sutik tamakualo kanayap ti amigak sila kay matakalo na ni tamani Nunavut metati kalaki kata tikito na hatak ni tiki kay nakatak to ni kanayak to ni pijit sa kakaktok to ni asago bekangin na tatako. Ame so ni pijit te kakso tik tayo maami kaksigo te kakto.
Steve Silva with CBC again. Asking for more support from the federal government. What does that say? Like, does that say that the Nunavut government wasn't kind of prepared for what's happening now? Or like when people hear, you know, there's a call for more help from the federal government, they might wonder why that's happening. Didn't your department kind of brace for this kind of influx?
Tahan na CBC ko ni government to hakkum ni tut sa kauti ham na simani si Nunavut palongayang simalang matamak ko nga tayo ma uha to hakka ma tut sa simayo ham na to ni government to hakkum ni takwa
operational staff have been working really hard to recruit and hire as many staff as they could, and that work's been going on for months. There's just not enough staff to go around right now.
Walat sinami kanayak tiat so tikay nakasimalaki tibi takigalaw simayuni kanayak tita kaswak tutik man yamigak tulari umatayla na mituin na kanayak titsay.
In regards to that advisement to self-isolate for 2 weeks if you don't have the booster shot that you made, I think it was last Tuesday, what are the parameters for that? Is it retroactive, or is if you don't have the booster shot, isolate for 2 weeks, does that start when you announced it last Tuesday, I believe?
Tako how jigyao takala ko bimakko pinasa si nasimalik to tako angikas aniteliga hamningin angikas malero di makko ni pinasa si ni pingaswan ni kapayaw si mangikuti naggadjawlek hiulaw tumipigyalo ni utila ka ubalo kanga tana 2 weeks pigya kaya ka aniteliga hamningin.
It started from when we announced it.
Trevor Wright, Nunavut News. I just got a couple of questions from one of my colleagues. When, I guess, ballpark, do you feel when will you find out schools will reopen? Like,
Trevor Wright,
it's going to be at least a week or so before we can figure that out. And it may well be that schools are open in some communities and in others they're on either rotating schedules or on remote.
Pinasako si ulat tumitaman na how ilak tabut how igun nang itabuman at sa tigi ilang kaya si adjiw dang ito ilang inunalin ni be matirun na lutik ilang inalik itar lutik ubalo niya kami nilin na lutik takwa sulinalo na ito gun nang ito maanaw yo.
Do you know what measures will look like for teachers coming back from the south and having to come back, having to teach, I guess?
Takwa ilin na ito siya kalunaning ato kano itaw lakan.
They'll be under the same recommendation as everybody else, that if you haven't received 3 doses of the vaccine, you isolate at home for 2 weeks on arrival.
Tayo matsay nakikulimano malitaw yari ni maligya kalak to pingayon ni kapayaw si mangikutik anite ligya kakayak to tikis si malirutik mako ni pinasako sini.
Thank you.
Thank you.
Thanks, everyone. We're going to have our next media conference on January 6th at 11 a.m. And we'll be sharing any updates via social media as well as news releases daily. Thank you.
January 4, may takot sa kanila ako yung malupi bala yung tigo tamak ko Facebook ko tigo to sakit si katal ng miyo.
January 6th.
Oh, January 6 mga.
Thank you.